Hey, this is Doug Fields, CEO of the Institute of Healthcare Consumers, along with my co-host Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. And joining us today is another one of the IHC's affiliate members, Liz Ryan, the Executive Vice President and Group Head of Health and Benefits with Wells Fargo Health Benefit Services. Liz, good morning.
Good morning, Doug. How are you?
Good. Great to talk to you again. To our audience, I had the pleasure of visiting with Liz and Patty this week in the Twin Cities. Appreciate your hospitality this week.
Oh, it was our pleasure. We had beautiful weather up here, so you hit it at the right time, right?
Yeah, I did time it pretty well, didn't I?
Come back in January, right?
Yeah, that's right. Maybe, Liz, maybe. Let's take a moment and talk about Wells Fargo's background and its activities in this HSA space.
Oh, okay, sure. Well, first of all, Wells Fargo is a global financial services company, right? The HSA is one of many products we offer our customers. We got involved with the HSAs on day one because we saw it as a financial product that our customers could use to either pay for medical expenses today or save for retirement. You know, and today, Wells Fargo is a national leader. We distribute the product either through employer-sponsored plans, or individuals can come directly to us and enroll online. Our customers are spread across 50 states. We service over 11,000 employers, close to 500,000 account holders with assets approaching $1.3 billion under management. About 30% of our customers leverage our integrated investment platform, which lets account holders put their HSAs to work by investing in one of our 19 mutual funds. So I think one of the things that I'd like to call out is that we have integrated our investments with our wellsfargo.com platform, which allows our customers to simply log in with one user ID and one password. So it keeps all of their banking in one composite, which makes a lot of sense for our customers.
It sure does, and particularly as you see more and more participation in HSAs and the dollars starting to flow in, you know, the
absolutely, yep.
balances increase. What do you see? How do you see the market? And you look, you know, 1 year, 2 years, 3 years ahead. Where do you see HSAs going?
Well, Doug, I think the obvious thing is that we continue to see growth in the industry, just like everybody else. We're very bullish on the industry, you know. But I think behind the numbers, there's a little bit of an interesting dynamic going on. One of the trends we're watching is the HSA adoption with millennials. Yep. You know, I would tell you that our portfolio today, that's the fastest growing segment. It's got about 27% of our account holders are between the ages of 18 and 34. And I guess to me, if you kind of sit back, it makes a lot of sense. You know, people in this segment, they're turning 26, they're coming off their parents' insurance plan, and they're just entering the workforce, and so they're starting to think about what they want to do with their benefits. And, you know, to me, this group, they're a very savvy shopper. They operate in a digital way, right? And, you know, they're not saddled, if you will, maybe like you and I are, with thinking about what we used to have and how we want to think about it. They're gonna look at the economics. They're going to see the long-term benefit of the of the HSA, and a lot of analogy goes into this with respect to how, you know, you saw the evolution from the pension to the 401k. So we're very excited about this segment. We think that there's lots of different tools we should be developing for this segment because they do so much online.
Liz, this is Brent. You mentioned in the beginning here that the assets in these health savings accounts are growing, you know, year over year. When you look at the assets and then you look at the safety and security around health savings accounts, you know, why is that important given the asset number inside of these accounts, the safety to those?
Well, it's the consumer's money. I'll start from that dimension, right? I mean, you know, so I think in the past people might have thought about, you know, these accounts, you know, Doug, you and I have joked about this as a spending account, and it simply isn't. You know, the industry has evolved where it's a savings account, and the consumer is starting to understand that, and they're becoming more in tune with this as a long-term benefit, not a revolving 12-month type of spend it down to zero mentality. And because of that, I think there's a wake wake-up call, if you will, around making sure that you're placing these assets. Even if, let's say, if you're an HR professional, make sure you place the HSA plan with a company you understand and you know where the money is sitting. And then if you're a consumer, make sure you do the research around where are you putting your household money, because it's not just a 12-month window. It could be over the course of your career. It could be a 25, 30-year horizon. And I'll share this data point with you. There's been all kinds of studies shown that says if you start investing, if you start saving in day one, and you have a 30-year horizon and you contribute at the maximum level, you can have $360,000 sitting in that account when you go into retirement with as little as a 2.5% rate of return. That's some serious money.
Yeah.
And so that's why we're very focused on making sure that it's safe and secure.
Yeah, and thus the Wells Fargo name behind what you're doing, correct?
Well, thank you for saying that. Yes, we certainly want everyone to understand that we take it very seriously. Whether you're commercial or consumer, the first thing that I would tell you is that we never share any of our data with third-party vendors. It just philosophically isn't something that we think is good business. We own, develop, and manage every technical aspect of the HSA, and I think that has tightened up, if you will, Doug, the exposure or the ability to, have a data breach. And I think that we live in interesting times, I'll say, and we all have witnessed what's happened to our good friends at Target and Home Depot. So you can't say that, how do I say this? You always have to do your research. Don't assume the organization you're meeting with has the security and data management figured out. Ask a lot of questions around it and make sure that you understand how the data is being managed and how the data is being passed within third parties.
I think that's very well said and very important. Talk to you're very committed to decision support for your account holders and to education. Tell us some things you're doing and some tools that you're deploying for your account holders to utilize.
Okay, sure. I think there's so much written and documented about the lack of knowledge or literacy. So I'm going to start from that perspective. I think we have approached this from the perspective that we need to do a better job than we're doing as an industry in getting people engaged and really understanding what it is that they're buying, right? I mean, I think there was a survey just published by the Journal of Health Economics that talked about last year's numbers where they thought that only 14% of Americans understood the basics. And that, to me, is a gap that we need to solve for if we're going to be thought leaders, right? So, our approach to it is, we started out very early on, and it was probably somewhat boring, shall I say? But we did enrollment meetings with our customers and with our consultants and with our other partners, where we had direct conversation with employees, trying to educate them. And I tend to call those combat conversations. I mean, they're tough, they're hard, right? And we've evolved into doing more things online. We've done some short videos and some webinars, and I think those, and we've made them fun to listen to, right? Because let's face it, people don't want to spend a lot of time on their benefits, and we understand that. But we're now embarking into an endeavor with an organization that I'm very excited about, and basically what's behind this is an interactive tool, and it's going to sit on our website. So if you came to us through an employer or if you came to us as an individual, you'll have access to this. We're not charging for it. But basically what it does is it allows you to enter in some pretty basic information about yourself. How much are you contributing? What's your deductible? Do you understand the HSA or don't you? And what it'll end up doing is it'll walk you through some information dependent on where you are in the life cycle of understanding the HSA. And I think the interesting thing that we like about this is that if you're a spender, it's really going to tailor the conversation to tips about using the HSA from a spending perspective. And if you're a saver, it's going to give you information around how you should be thinking about it in terms of saving. I mean, let's face it, that's been one of the dynamics that's been challenging for our industry, because this product serves what I consider to be very polarized interest in terms of how you want to use the HSA.
Yeah.
Liz, we got about a couple minutes left on the program, and as you look at your business, what's coming up next for Wells Fargo around this specific division?
We're very focused on some payment tools. This week we just announced our partnership with Apple Pay. And what that means to an HSA customer is that if they have the iPhone 6 or the iPhone 6 Plus, they can use the device to make their payments at a point of purchase where the near-field communication is. So it's another example of how we're using innovation and making sure that it's secured, because we do believe this type of payment tool will be far more secure than what we currently have in the industry with a mag stripe. So we're very, very excited about this endeavor. That's
very exciting. Leave our audience, Liz, in the final minute or so here with a couple takeaways.
I think as you begin to look at your benefits in totality, and you want to think through how you need to get yourself prepared for 2018, I think the thing that's top of mind for everybody is, how's the Cadillac tax going to impact your plan? Our lead inside counsel just released a white paper on this topic. Lots of our customers are talking about that, and I think we're going to be sharing that with you at your forum in Vegas. Yep. And I think what I want to try to do is continue the conversation. I talked about literacy, and to us, it's all about how do we keep that conversation going so people become better consumers of their health care.
Outstanding. Liz, really appreciate you joining us today. You enjoy your weekend up in Minnesota, and to our audience, you'll be able to visit Liz's team out in Las Vegas, and they will be participating in a share session led by Todd Berkeley as well as being a sponsor, and we appreciate that. You can also find information on her division on our website, since they're an affiliate member. But Liz, we really appreciate the time today.
Oh, it was my pleasure. Thank you very much for having me. You guys take care, okay?
Thank you, Liz. You too.
You as well.
Bye-bye.
And to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.